One of the questions I frequently get is, how do I know if my eyelid surgery is covered by insurance or not? And the best way to explain that is there's several criteria that the insurance company looks at. It's got to be related to vision, and it has to be related to safety and your normal activities of daily life. So the way I would think about that is it's almost like an umbrella. You can walk around under an umbrella and you can function fine in life because you adapt. But you're missing that over there, you're missing the car coming up. You know, one of the things I see is people say, you know, I think I need to take the key from mom. Are you going to talk to her? And it's not that mom or dad, as they get older, can't drive and they're not capable in their reflexes. The problem is their lid is drooping down and they don't see the car till the last minute, and they don't have time, and you wouldn't have time either if your lid drooped down to stop before they get in a fender bender. So that's one of the reasons it's covered. It's a safety hazard. So ptosis is covered for that reason. It's also covered if you're a young child and your lid is blocking some of your vision. Your brain and the pathway from your brain to your eyes and your visual field, it can't develop properly, and it's called amblyopia. It's a fancy word, but it basically means that some people call it lazy eye, but you'll see people that say, I've never had good vision in one eye. It's because when they were a child, it didn't get repaired. So that's another reason. The other reason that's important, especially as we talk about social things going on and being woke versus being awake, is bullying. Some kids will have a droopy lid and they can't see. They're always raising their eyebrows, and people tend to stereotype that as not being smart or something's wrong, and they get bullied. And I've had lots of kids that we've repaired it, and it's eliminated them being bullied. It's affected their self-confidence. So those are all reasons where it gets covered. The key thing is you have to go to somebody that understands all that can do what's called a visual field test, and they can document that you have problems. And when you raise a lid, it's improved. And if it's improved 30 degrees and you document it correctly, send it to the insurance company, it's covered. And they pay for it, and they should pay for it. You pay a lot of money for your health insurance, so if you have something that's covered, you should take advantage of it. If you go to a general plastic surgeon, they don't do those kinds of things. They don't understand the criteria because they're not trained in it. But if you're trained in ophthalmology and you're trained in plastic surgery, you get the best of both. And that's what we do at Oculus. That's the Oculus difference.